Hi there, I'm Amy, and this is Hospice 101. Today we're talking about the signs that you or someone you love might be eligible for hospice care. This is important information because understanding these signs can help you make better decisions about care. Let's start with the basic question. Who qualifies for hospice care? The main requirement is having a life-limiting illness where a doctor believes the prognosis is 6 months or less. But here's what's important to understand. You don't need a specific diagnosis to qualify, and you don't need to wait until the very end. In fact, hospice care is most helpful when people have more time to benefit from it. So what are the signs that hospice might be helpful? There are several important patterns to watch for. First, increasing difficulty with daily activities. This might mean needing help with bathing, dressing, or getting around the house. If someone is spending more and more time resting or needs assistance with basic care, that's a significant sign. Second, unintended weight loss. When someone loses weight without trying, especially if it's noticeable over just a few months, this can indicate that the body is having trouble maintaining itself. Third, frequent trips to the emergency room or hospital. When someone keeps going back for the same condition, or when treatments aren't helping as much as they used to, these are important signals. And fourth, recurring infections that don't respond well to treatment. This might include pneumonia, urinary tract infections, or other infections that keep coming back. Now let's talk about some of the most common conditions where people benefit from hospice care. Cancer is probably what most people think of first. This might be cancer that has spread to other parts of the body, or cancer that isn't responding to treatment anymore. But cancer isn't the only condition. Heart failure is another common reason for hospice care. This is when the heart has trouble pumping blood effectively, causing shortness of breath even at rest, and difficulty doing everyday activities. Lung diseases like COPD can also qualify someone for hospice. This includes being short of breath most of the time, needing oxygen, and having frequent hospitalizations for breathing problems. And the most common disease associated with hospice? Dementia or Alzheimer's disease, especially in the later stages. This might include difficulty walking, trouble communicating, or needing help with eating and drinking. Here's something else really important. You don't always need one specific terminal diagnosis to qualify for hospice. Sometimes, it's the combination of several health problems that makes hospice appropriate. This might be someone with diabetes, heart problems, kidney disease, and frequent infections, all happening together. What matters is the overall pattern, the person's declining function and quality of life. Now, let's talk about something that's really important but often overlooked: timing. Most people who are eligible only get hospice care for about 2 to 3 weeks. But research shows something important. People who receive hospice care for longer periods, typically months instead of just weeks or days, have better symptom control, better quality of life, and their families feel more supported. The challenge is that these conversations often happen too late. By increasing awareness about hospice eligibility, we can help more people get the care they need when it can do the most good. So what should you do with this information? If you recognize these signs in yourself or someone you love, it may be time to have a conversation. Talk to your doctor or healthcare team about hospice care. Ask questions like, do you think we should consider hospice? Or, what would hospice care look like for our situation? Remember, asking about hospice doesn't mean giving up hope. It means hoping for comfort, dignity, and the best possible quality of life. If you'd like to learn more about hospice eligibility, or if you have questions about whether hospice might be right for your situation, please reach out to us at EverLight Hospice. We're here to provide honest information and compassionate guidance, with no pressure and no judgment. You can also bring up these questions with your own doctor or medical team. The most important thing is having the conversation, because everyone deserves to understand their choices.